Hello everyone, my name is Maria Ochinskaya and today we will talk about intrapartum care. So now we are on second slide and it's introduction. So we will talk about stages of labor, we will talk about pain management, we will talk about therapeutic assistance on different stages of labor and how it can help mother and baby because we both involved in that. Also we will discuss about assessment during the labor, assessment of mother and assessment of baby, and also we will monitoring for complications, and also we will discuss about nursing care during the different stages of labor. So at the beginning we need to understand what is intrapartum care. So intrapartum care is care about mother and baby during pregnancy, delivery and labor. Exactly. And so now we are on slide number 3. So this is first stage of labor, and this is stage where cervix open by from 0 to 10 centimeters dilated. And this stage is divided on 2 phases. First phase is early or latent. So on that stage, cervix dilated on 0 to 5 centimeters. Constructions of mother irregular and it's mild or moderate intensity, and also duration of constructions, it's usually 30-49 seconds, so it's less in the next phase. Next phase is active, and here cervix dilated on 6 centimeters to 10 I guess, which is 10 I believe. So here already we have strong constructions and they are regular and they are longer. It's 40-90 seconds, so it's like over 1 minute. So assessment, we assess of course cervical dilation, effacement, also we assess oxytocin, prostaglandins, regulate constructions and cervical breathing. We also measure constructions frequency. In active phase it has to be 1.5 minutes. Also we monitoring fetal heart rate, and also we can assess mother with Leopold maneuvers, and we also place external electronic monitoring and talk transducer for uterine activity, frequency and duration. So nursing care in that stage, we reposition monitor with movement. We provide comfort and emotional support. Also we educate patient and family about progress. Basically we are waiting and we monitoring, assessing, and we are prepared, and we make a comfortable environment for that stressful situation, because it also very painful, because this is I think the most pain occurs too. So we are on slide number 4 right now, and this is second stage of labor. So basically this is pushing stage when cervix fully dilated and it's completed 10 centimeters, and effacement is 100, and this is time where mother pushing baby, and we assess mother for construction strength and duration, and we assess baby for fetal heart rate. Here we're assessing for wheel chop, deceleration, acceleration, and also our nursing interventions assist with effective pushing techniques, positioning upright if tolerated, monitor for fetal distress and expected outcomes. It's a safe vaginal birth of newborn. So we are on slide number 5 right now, and this is our third stage of delivery of placenta. So this is placental separation and expulsion. It should occur within 15-30 minutes. If it's longer, it can cause hemorrhage, and it's like concerning why it's not coming. So assessment: signs of placental separation, gush of blood, when cord is becoming longer, and also of amount of vaginal bleeding if mother had vaginal birth, so it has to be up to 500 ml. If mother had a C-section, it has to be up to 1000 ml of blood. If it's more, it's considered like a hemorrhage, post hemorrhage. So medical interventions: so oxytocin administrations and controlled contraction. And in our nursing care, it's monitor for postpartum hemorrhage, and assess uterine firmness. And if fundus is boggy or upright position, we monitor like mother should void after, like after delivery of baby. And also if it's boggy, we need to massage so it will be firm. So expected outcome: it's complete placenta delivery with minimum blood loss. So we are on slide 6 right now, and this is fourth stage of labor. This is 4 hours postpartum, and we focus on here on maternal stabilization. We are assessing for any postpartum hemorrhage. We assessing vital signs, fundal firmness, position, lochia amount. Nursing interventions: so we promote bonding skin to skin. Also we doing pain management if needed. Also we educating like heavy bleeding, dizziness. Also we teaching the mom to avoid like very frequently, like as soon as possible. If you want to avoid, just don't wait too long and go and void. So expected outcome here: it's stable mother and newborn. So here organized like stages, and how we can assess, monitor, and apply our nursing knowledge for that beautiful process of delivering baby. So here is divided by mother and baby. What we need to assess for mother: it's vital signs, pain level, contractions, pattern, cervical dilation, effacement, and station. And for baby, we need to monitor fetal heart rate, variability, acceleration and deceleration. And also after when baby delivered, we will assess Apgar score. We will assess on, like, we will do some lab tests, sugar test, bilirubin. We will assess skin color, and doing all nursing interventions what we can do. So we're on slide number 9 right now. So pain management. So pain management basically 2 aspects: non-pharmacological and pharmacological. So non-pharmacological, this is breathing techniques, relaxation techniques, also position changes and walking, also massage, counter pressure, and also warm shower / bath. so pharmacological. So here it's more we need to be careful because, for example, systemic analgesics like opioids, we will use route IV or IM, intramuscular or intravenous, but for example, opioids, we don't want to administer if for delivery of baby left like less than 4 hours, because it can cross placenta and can affect the baby, so we need to be careful with that. Also epidural, spinal and combined spinal epidural, we also need to be careful with that. We need to insert 5 ml to 1000 ml to the mother, so she won't have headache. And this is all about pain management. So we are on slide right now 10, and this is slide about how we will monitoring for complications. So birth trauma, this is for both for mother and baby. For example, we need to assess mother for any lacerations. We have like stages from 1 to 4. Do we need surgery? We need educate mother to use like peribandal after that. Also, if we need stitches, we need to perform, like not us but surgeons. Also, we need to assess for any edema, hematoma, and also about baby, we need to assess baby. For example, if baby has syphilis hematoma, we need to know that this is like concerning stuff, because it can cause jaundice, because like collecting of blood on baby's head, it can cause loss of bilirubin, and it's why we need to assess for jaundice and to be ready if it's happened. Also, we need to be ready for prolonged labor, and also we need to be ready for postpartum hemorrhage. Postpartum hemorrhage is we need to administer oxytocin if postpartum hemorrhage happen, and also we need to assess is it full bladder or empty bladder, place of fundus. If it's boggy, we need to massage it so it will be firmer and it will be constricts and it will be nice, good, firm fundus. So for any infections we need to assess. So for hypertensive crisis, and also we need to educate mother, like probably she will be in shock. So how to care about, so how to clean yourself, and what to do if you have stitches, like if you have any lacerations, and you need to care about that. And that's all for that slide. So we're on slide 11 right now, and its conclusions. So nursing interventions with mother is essential, because we providing care not only about mother but about baby. So this is very comprehensive care. So we need to assess mother for any complications. We need to provide her therapeutic communication. We need to make her to feel comfortable in that vulnerable moment and very painful moment. We also need to give holistic care. If she doesn't want epidural, for example, she doesn't want, so she can refuse, or we need to base our opinions on culture values. For example, if it's Amish mother, we need to be concerned about blood transfusions, and also if for example it's Muslim, we need to be concerned about food, because I know we don't eat food like pork. We didn't eat pork because for some religious aspects of their culture. So we need to monitoring everything about mother and also about baby. And we need to assess baby with Apgar score. We need to assess baby just like for any conditions like cephalohematoma, because it can be concerning, jaundice, or even withdrawal, like if mother was addicted. So this is a very comprehensive care, and we need to be ready for that. And this is actually very interesting scope of practice, because this is like you need to be very quick. And on clinicals, when I have experience, I think like nurses, like people who work with babies, they're very fast. So, and very like very fast thinking, because you don't have a time for do any mistakes. For example, Apgar score you need to do in 1 minute of delivery of baby, and also after 5 minutes. So it's just like it's nothing. You don't have a time to think. You just need to know, and this is very impressive. That's all. So thank you for your attention, and here was references. Bye bye.